Can you see Bhakti, the tech team? Can you see Bhakti Samant there? Or Mangal Kadil? Bhakti has come.
Yeah, I'm here.
Hi, Bhakti. Hi.
Hi.
Well, they're in time. Hi, Gohan. Join.
Good morning, sir.
Hi,
Good
hi.
morning.
Good afternoon.
Good afternoon, sir.
Suresh is there. Gohan, John, Preeti. Mangal, can you hear us?
Yes, sir.
Mangal, can you hear us?
Sheikh, we are live and we are audible to the
Can you
people.
start it, sir? We are in time. Please start.
Wait for 2 more minutes. Let the people join. Mansi, please share the YouTube link so that we can send it to others.
Yes.
Abhishek, we can start.
Good afternoon, everybody. I welcome you all on behalf of Interpretation of Neurorehabilitation for this important panel discussion on role of multidisciplinary team in brain health. This program is part of the World Brain Day program, public awareness activities, in collaboration with World Federation of Neurorehabilitation and World Federation of Neurology. We have a STEAM panel today. The panel consists of a multidisciplinary team, Dr. Gohan Ramamurthy from Tamil Nadu, a neurologist, Dr. Mangal Kadi, a psychologist from Nasik, John Solomon a physical therapist from Manipal, Karnataka, Dr. Suresh Kumar, an occupational therapist from Hyderabad, Preeti Shetty from Bangalore, and Bhakti Samant, beautician from Mumbai. And we are lucky to have esteemed Dr. Professor Surya, the president of IFNR and president of Indian Academy of Neurology, to moderate this session. I'd like to hand over the dais to Dr. Surya, please.
Good evening, friends. It indeed is a great pleasure, and today I can see the enthusiasm among the whole Indian community with neurology and associated team to create an awareness on World Brain Day. We are into the various programs today, and we will be celebrating the full week program. NeuroRehab subsection of IAN has come out with 3 more programs in upcoming week, and I'm sure you all will be very interested in joining that. Now let's talk about the brain health. What does we mean by brain health, and how does the neurorehabilitation team is going to work on brain health, how they each other complement one each other. So we have multiple panels, and I have Abhishek, who has already been introduced, and we got neurologists, we got neuropsychologists, neurophysiotherapists, occupational therapists, speech therapists, nutritionalists. I wish we had a social worker also been part of this team, and of course talk about it. And so, who should be the opening batsman? So let's come to the most unknown person among our team is nutritionists, and we normally don't even think about it till the speech and swallow therapist says that let's call the nutritionist in this patient. So Bhakti, let's begin with you.
Yeah.
She's the chief dietitian at Kokilaben Ambani Hospital. She is of course associated with various certificate courses. So let's come to the point. Is, grandmother used to say that eat in time, eat proper food, khana chaba chaba ke khana chahiye. So, what is the role of gut in your brain health? How it is being brain and the gut is connected?
Okay, so talking about gut and brain, I think it's now proven when we talk about the gut-brain axis that all our senses, whether it is hunger, it is satiety, it is feeling of eating something, it's all associated. So there are signals which are passing from the stomach to the brain, even when you are hungry, even when you are full. So obviously there is a very close connection, and if we look, this connection works both ways. It's not just the stomach giving a signal to the brain, but also the brain giving a signal to the stomach. So if you say our gut is almost like a second brain only, right? So our brain tells us what to do, but our gut also controls a lot of these senses that we come across. And in fact, if you look at it, our nervous system triggers a lot of emotional experience that a patient would experience for a very simple thing like someone who's having a gastric discomfort, or someone who might just have, some kind of a constipation issue or a bloating issue. And we know that this all is going to have an interconnection to the brain. Because when you're dealing with these issues, definitely your anxiety levels increase, your irritation increase. So that really very closely explains, the role of the gut and the brain. So it is important to keep the gut healthy, because if your gut is healthy, then it will help your brain to also function in that manner. So I think that way the gut and brain are very closely associated.
That's right. I would come back to you because there are so many things in my mind about the appetite, and you have already mentioned. So I come back to you, but I go to the from nutrition, go to the Preeti. And Preeti, now how does brain health reflect to you as a therapist, a speech therapist, swallowing therapist? How do you look? Your patient come to you. How you look at brain health in people who have affected speech as well as swallowing?
Thank you so much, sir, for a wonderful question. When I think from my end, I think about speech, I think about language, I think about communication, and I think about swallowing. So as we all know, there is physiological change that happens as an individual age, or if there is a disorder, there is a neural decline that happens in the brain and spinal cord. Again, the number of neurons decrease, the axonal thinning happens, the number of dendrites that are they're going to decrease. So this is all going to bring a barrier to the communication. So when I say communication, it has both speech and language. So as a speech and language specialist, I feel that it is going to affect the speech and memory basically. And it has an added effect as the aging comes into picture. Hearing is something that brings in a lot of information that we'll have to look at. So there's going to be a cascade of events, maybe in terms of problem in word retrieval, maybe a difficulty to have dual task or multitasking. As our body loses the physiology or muscle or neural control, this effect is not, it also happens to the vocal cords that are there. Again, the elasticity of larynx gets affected and it gets weakened. So the musculature that is important for speech is also important for swallowing. So in these population, whoever is healthy aging as well as somebody who is having disorder, all this physiological and structural manipulation that is important gets affected in terms of swallow and speech. For communication, definitely it's going to affect the memory, working memory, and how they communicate for their daily living. I think I look at that as an important factor when I look at it as a speech pathologist for intervention, sir.
Absolutely. So we'll come back to you on further questions. I move on to our occupational therapist, Dr. Suresh. Suresh, the activity of daily living is been what you are looking after the people. You are the one who take care of ADL of the patient. And how does it reflect on the brain health when his activity of daily living are affected? Maybe he is not handicapped in beginning, but maybe some diseases or not at all diseases, age itself affecting his ADL. And how do you look at that? And how you think that we can help these people and guide them?
Thank you for that very interesting and relevant question, sir, because lots of occupational therapists themselves are trying to find answer to these questions and then trying to reflect on what they can bring in their practice to help people who have issues in terms of connecting cognitive functions or brain health to activities of daily living. As an occupational therapist, I would say that to execute an activity, it can be self-care, it can be, say, a basic activity of daily living like brushing your teeth, to an advanced level of activity like money management or medicine management or even childcare and management of children at home. It needs to have the connection in terms of the components related to performing in activities of daily living independently. And most of the components, apart from the one that we as therapists usually look at in any context, which is physical disability, is something that is quite multidisciplinary in terms of the components. So we have cognition, we have perception, we have socio-emotional areas which has to kind of link together. We also have the psychological component exclusively. So all these kinds of components are essential to execute an activity, whether it's a simple task or it's a kind of a complex task. And to execute this activity independently without anybody's help, you need brain health and brain function to work together rather than kind of looking at it as an exclusive area where we need to train a person. Say, for example, you train a person's cognition and then say, this person can do banking activities fantastically. No, that's not going to happen. So you need all the components together working. And as you rightly pointed out, it requires brain health and successful functioning of the neurological aspects of our body to perform an independent activity of daily living. You're on mute, sir. Sorry.
Absolutely. So I will come back to you again on these points, because these are very, very important point, and we will discuss about how a person look may be normal, but his brain health may be affected, and how do we assess that. I will come back to you all individually. John, are you there? So now next we move on to our physio chief from Manipal, Dr. John Solomon. John, you know that everybody talks about that exercise is good for brain. I walk 10 kilometers and brain will be strong. Is it that your brain is strong, so you run, you walk better, or is it you do regular exercises that your brain health become better? So what is, it's like chicken or egg?
Excellent question, sir. Actually, it's a very tricky question as well. As I said, it could be a chicken and egg story also. But as I said, there is one thing is for sure, the relationship between physically being active and having a brain health is well established. There has been a study in neurology that was published looking at the physical exercise activity in terms of risk of dementia, which has a similar thing where they had looked at quite a few patients over a period, and then after the long time, they have checked whether their brain health, how is their brain health when they were physically active, and those who are not that physically active. And it showed that those who have a very good physical activity had reduced chances of developing dementia and Alzheimer's. I remember there was one talk in TED by Wendy Suzuki. It's one of the very popular videos in TED. I think it's have more than 8 million views also. It talks about physical exercise and brain activity, and where she describes how being and her work is on that. She's a neuroscientist, and how she looked at brain health and identified increase in the amount of hippocampus as well as prefrontal cortex area in those people who had maintained at least 150 minutes of moderate exercise per week consistently for a long period of time. So we know there is a relation, but as you said, to do exercise also you need to be healthy. You have to have a brain health that functions you to move around well. So that definitely is there, and a decline in that also could affect the physical activity, and we have seen it. But the relationship is there definitely, that if you are physically more active, definitely that your brain health is much better, and you can stay healthier, or you can reduce the chances of, or reducing the decline the occurrence of dementia or Alzheimer's over a period of time. It can slow it down.
Absolutely. I think it is a very difficult question and answer, but I think the gist is that everyone must do the exercise at least 30 minutes a day for 5 days a week, and that's something which we have to be following up. So we move on to our neuropsychologist, Dr. Mangal. You know, the commonest questions which we face, yaad nahi rehta hai, forgetfulness. Is it a problem of brain health? And how do we look at it? Who are the people we look at it? Is it because even mother comes and say, my child is not doing well in the exam. The 10-year-old boy is getting forgetfulness. And then there is a 40-year man working in backside, I forget name. We also forget name, but the 70-year man comes and say, I'm forgetting, I can't remember, I saw this man, but I can't remember. So, you know, at various ages and this memory discipline, how do you link the brain health with that, and how you can make the brain strong in memory?
Thank you, Doctor, for this opportunity today to talk. And first point, I must say that there is difference between remembering and forgetfulness. So if somebody is not remembering, it may be in our language, we can say that it's a load of information which is coming into the brain. And when the normal brain doesn't look at it intentionally, giving all attention to it, then of course the information will not be processed that way. And it will be a little not remembering things properly. But forgetfulness is totally different. And forgetfulness can occur at any age. It doesn't require any age to forget. Because whenever there is problem to the brain, so it may be before birth in the second trimester, first, third trimester, whatever it may be for the mother. So there is developmental problem for the brain. And suppose some trauma happens at the time of birth, then also there will be a problem for the brain. And after that, like as we know, epilepsy is there that carries for a very long time. Then in adolescent stage, if everything is fine, but then children turn to drugs, they take, people are abused, alcohol abuse, and then there is suicidal attempt, and there might be a murder attempt. So whatever it may be, it's going to cause problem for the problem for the brain. And any cause, whatever I have been saying, and even for the adults, we can say that there is trauma at any age. There, like we see accidents, road accidents or any other accident, then stroke and Parkinson and Alzheimer, dementia, whatever the list of things. Apart from that, I must say that there are very rare brain diseases also, like rabies encephalitis or any other these rare things, even tumors, uh, that sort of a thing. So this is all going to make a difference for the brain in remembering things. And it's not just remembering, but it's like processing that information. So if the information is not processed, suppose we have dietitian here, occupational therapist, all therapists are here. So if there is some problem for the neuron itself, so it's not going to take any of these sensory information properly. It cannot process all of this information. The coding cannot be done properly. And then of course, there will not be in the memory. So it may be short-term memory, working memory. And when that is affected, of course, there will be nothing in the long-term memory. And there is difference between children having developmental disorder. The child one day is going to be an adult. One day, the developmental, whatever the problem with the brain. And that brain learning and the other brain, which was actually normal. But then after that, in the real world, suppose the brain
Mangal, I would want you to give answer very brief because we got a big panel and
okay.
cannot have long discussion. Please.
Okay. So learning and remembering for these two brains is different. So for the first brain, it will be a new learning because the brain has problems since the beginning. And the other brain, which has already learned, but because of this deficit, it is not remembering now. So to keep it properly, all of these causes which I have been discussing, we have to look after that. And then we have to keep this brain very healthy.
So I would request all the panelists to be very brief, short, because we need to give a absolute crisp answer to our audience so that they are interested in our talk. We need not explain all the mechanism and everything. And I can also take more number of questions. Otherwise, it will only be 2 or 3 questions will be asked. Guhan is the last person who is a neurologist and You know, Guhan, the grandmother used to say, you must have heard from your grandmother, if I do not know how much that you were close to your grandmother. Beta time pe so jao, time pe kha lo. Have you heard these two words from your grandmother? Sleep in time and eat in time.
Yes, sir.
All right. So my simple question to you is that how much sleep is important for the brain health?
Thank you, sir. Thank you for the opportunity, and also thank you for the wonderful question, sir. So it all boils down to the brain function, primarily, which is the cognition, conation, and the affect. So if we are going to look into the cognition aspect, as ma'am was discussing beautifully about the cognition aspect, to have a good cognitive function, to have a good affect, and that is the emotional aspect, ultimately we need to have a good connection, which is the physical activity. And there are four things apart from physical activity, three things apart from physical activity that is required. One is the substance abuse, which needs to be avoided. The second is the physical activity, which was already discussed. And the third thing is the sleep. And though we just lose our consciousness in the process of sleep, it is actually during this sleep that so many active things happen. And an ideal sleep would be between 7 to 9 hours, but there is no strict quantification for each individual. But that amount of sleep which refreshes you the next day is the ideal one, which is to be individualized. But 7 to 9 hours, that's good enough. And this sleep not only refreshes your memory, and it not only organizes your memory, which you had in the previous day, but also it helps to remove the unwanted things. And this was very evident from that a good sleep removes amyloid and your beta amyloid. If you don't have a sufficient sleep, then subsequently your disease. And finally, I would like to conclude by saying that even 3 night continuous sleep deprivation can increase the risk of diabetes by about 3 times. So that's how important sleep is.
So I think the minimum of 7 hours sleep is what you recommend for the good brain health. And so from the sleep, we talk about 2 points which our grandmother says, time pe sona. I come to the nutritionist, time pe khana. So what time has to do with the food and brain health?
So, in fact, currently there are a lot of studies which have happened where the concept called as chrononutrition. So, it is a concept which is talking about eating the right food at the right time in the right proportion. So, the timing plays a very important role. Most of the time, if you look at our Indian diets, you will find that majority of us, irrespective of whatever our working hours are, we are the most active during the morning hours, especially those who are the morning times. We are most active during the morning hours, but our food intake is maximum only in the later hours of the day. And that is what is actually changing this entire paradigm shift that you can see in our health, where you will see an increased incidence of diabetes, you will see an increased incidence of metabolic syndrome, increased incidence of inflammation in the body, and definitely that inflammation is going to affect the brain as well. So eating the food at the right time is very, very important specifically. And I think this concept, I mean, in India, though we don't have any studies on nutrition, but abroad there are a lot of studies, big breakfast studies, which talks about the importance of these timings and the portions and how it is actually going to affect your health. So I think very, very.
Is there any relation between place? You said time, place. So where you are eating, does that make a difference?
Yeah, yes, definitely. So your social, the surrounding that you are sitting and eating, or what you are doing and eating. So there is no control or no thought process going in when you are doing some work and simultaneously eating. So you really don't know how much you are eating and what you are eating. If you are sitting across, individuals whom you are not very comfortable with, again, you're not going to, enjoy the meal that you are eating. And yes, if you're sitting with friends with whom you are, the best of friends, again, you might be overeating, depending on, the people you are eating with. So yes, that also makes a absolute point.
Yes, because again, the grandmother used to say, while you are eating, don't watch the TV, don't read anything, just eat. So why I'm bringing this point is because these are the old saying, and we may not have those times the scientific background or the scientific validity of what they were saying. They were saying from their wisdom, or they were much more knowledgeable than all of us. But those true facts are today coming into the absolutely with the scientific base that we have been doing or we are researching. So that's why I want to stress upon for the people to know that. So Preeti, now how do you go about when a patient comes to you with, say, swallowing difficulty? Now, there are many people, as age grows, they get some difficulty, they get choked up. So obviously, when they come to you, you start knowing that elderly people, difficulties, some cough while swallowing. And what I want to really ask you the question, which is for a common public, is that some people drink water fast, some people eat water, eat food fast, and they get choked up, and they get cough. So obviously, somewhere the brain get affected because there can sometimes be hypoxia. So what do you want to suggest them, that how do they, while they are eating or swallowing and drinking, what are the things they should take and be careful?
Thank you, sir. Absolutely wonderful question. There is a connectivity between this and the previous question of mine. So I would say that anybody comes in, we do an evaluation, we get a baseline. Baseline is very important and we work on that. So the intervention strategies that's going to be there is same for everybody. That is compensatory strategies, behavioral modification, dietary modification, or interventions based on manuals. But when there is elderly, we'll have to take much more cautious. We have to be much more cautious because we have the physiology that is different. They are not going to process each and every mouthful or any food or the bolus that they take in. So there are certain steps that we have to take. We know from the previous answer of mine that there is physiological change, there is neurological change, there is muscular change that's going to be there. So we have to allow them to take more time to complete the meal. That's first thing that we have to do. Second thing, avoid distractions. Again, your concept of your grandmother telling you to not talk in between, not distract, not watch TV, concentrate only on eating. That's what comes in again, sir. So another thing is, if you have to, example, they may not be able to eat or there is dexterity, you may have to sit face to face and give spoon by spoon. Make sure that they are done with the first spoon and then take the second one. Again, time is important. Making an eye contact is important, and giving them instructions slowly, because there is hearing that comes into picture, there is memory that comes into picture, specifically working memory. So we have to be slow, we have to be clear, we have to be loud, and we have to make short and simple sentences that's not going to they should not have any difficulty in understanding the commands. So basically, these are the safe swallow strategies along with the intervention strategies that we are doing, which is very, very important. And being patient is much more important, because the caregiver and the therapist, whoever is going to be there, is going to make a difference. So I think that would be the take-home message.
Thank you. So Suresh, I again come back to very, very basic questions. You do see a lot of children, and I want very crisp and precise answers. And mother comes and say, my child is bhola hai. Nobody says that he's slow learner, or he says, this is mera bacha bhola hai. Now, many times this is just the villages, the mother comes and say, the grandmother says, and they think that everything is normal. And in children, it is, some child may be very hyperactive, running around, throwing the thoda badmaas hai, shaitan hai. Now, these are the two extreme what we see. And I want you as an occupational therapist to guide the people that there is a brain health being affected, and this energy can be channelized in these people from very early stage. So how do you tell and guide these people?
Thanks for asking me this question, sir. So this is the real life scenario. Everybody forget about the city life, forget about people who know everything about the problems that are neurological or super specialty issues. For people who are in the rural areas and people who have identified some issues in their children. They definitely say what you say. And if they come to me and then say this, and I do identify certain specific problems in these children, the first thing that I would like to tell them is uh, aim for independence in activities of daily living. And that is what everybody wants. They do not want to know whether the child has got hyperactivity or issues in attention or issues in concentration. They want to make sure that the child does what it is supposed to do for that particular age independently or with support from the family members. So I'd basically stress the importance of focusing on getting back to everyday living and ensuring that the child's role for that particular age is kind of independently performed as opposed to increasing their sensitivity and awareness about the impairment with respect to technical diagnosis and terminologies as such, using technical jargons and definitions to say this is the issue, and then blow their mind and spoil their brain health by talking about the ill effects of a specific problem. And the second idea that I would basically suggest them is to go back to their own routines and then observe the child on their own in terms of what exactly is the issue, what is the degree of severity of the problems that they identify, not in relation to the impairment, but in relation to the performance of activities of daily living. So is there areas involved in playing or schooling or socializing with children? So the second aspect would be to make them self-assess their own kids and then come back to us and then set a goal for the child related to activities of daily living if that's an issue.
I clearly understand, and I think this activity of daily living has to be very well explained to the parents of the child that this is what you should be looking, because many times the parents themselves don't know what they are looking at. They are only interested if their child get better marks in the school. Beyond that, they don't think at that point of time. And I think this is the guidelines which we require. Now, John, continuation to your previous question, what we asked you about the chicken and egg and exercise and brain. Now, suppose we have a patient with stroke, and obviously those who do the exercises, they do well. But those who don't do anything, do they do badly, very badly, or they still will do a better? In term, what I'm asking you is that how we can improve the brain health. Is this alone the exercise, or it is our multidisciplinary team which work together to get the things done? So it's like one wheel, four wheel, or all the wheels?
Thank you, sir. Again, that was a wonderful question. And this is especially is our major research area as well. And so what we have seen, what we seen, and also we know from research as well is that when we look at stroke recovery, there is some amount of spontaneous recovery. So up to 3 months, with or without treatment, patient may improve to an extent. But after that, to have a better improvement, we see that patients who do more activity tend to do better. Now, there is also a question, how about those patients who start a lot of activity much earlier after stroke? And we are still, this question has yet to be answered, and we are also researching that as a part of one of our PhD work. Here we are looking at multidisciplinary team. It's important when we say being active. Active is not always physically active alone. It includes being active in communication, active cognitively, and active being socializing with people. So everything is a activity to brain, not just only physical activity. And here's where the multidisciplinary team comes together and can improve the activity level of the patients after stroke. So the speech language pathologist, psychologist, occupational therapist, physiotherapist, everyone work together as a team to improve the activity level of the patients at hospital and after discharge if they can come to a rehab center as an OPD. So improving activity as a whole for brain, which includes physical, mental, social, cognitive activity, is something that should be able to produce a better brain plasticity and recovery. Still, we do not have clear evidence. We know the science behind it, and we hope that will work. So we want to see better activity and better recovery with a group team of people coming together.
Absolutely. I think this will be very fascinating subject, and we should look at this research and look at it. So Mangal, the next question to you is a slightly more difficult one, but you are a neuropsychologist. We say that, to keep your brain health active and be, more intelligent, improving your IQ, do some cross games, do Sudokus, do some quiz, and keep on doing that. Now, is there anything, those who don't do anything and those who do anything, is there a substantial differentiation in their memory, cognition? You think that these are the games, these are the things which may make, or is it do any other brain activity which can improve your networking in the brain is more important than X, Y, Z at the spinal level? So what is your suggestion to our audience?
If it's about small children, it's a learning process. So they keep on learning. I'm talking about the normal brain. So if they are children, they will keep on taking new information and so on. And the problem comes after 60, age of 60. So people think that after they retire, after the aging is there, forgetfulness will be there. So it is not like that. So to keep it healthy, the brain health consistently throughout the life, I must say that after the retirement, the person should do whatever the things he was doing before. So that means the brain activity should continue. The brain should learn new things every day, because the learning, a lot of learning is done before, but the learning has to be revised, because the brain would say that, okay, this brain doesn't require now, so let's forget that. And there is neurodegeneration, natural neurodegeneration after 45 anyways. So the activity, if not kept, which will involve both the hemisphere, which is very important. Because if somebody is doing just mathematics and having just puzzles and this thing, it's not going to give them that brain health throughout life. So the other hemisphere is also very, very important. That is about creativity. So creativity, whenever they find,
I think Mangal, they're not able to hear Dr. Mangal. We probably lost her voice. Is there? So till Mangal get her connection with the voice proper, let's move to Guhan. Guhan,
Yes, sir.
Common thing we ask, and I asked you the sleep question, and the other question which immediately come to my mind, and I want you to address our people so that they know that how important it is that people sleep during the day. There are a typical kind of posture, patient has short neck, obese, sleeping during the day, excessive, or whenever they're sitting, they just go doze off. And then we ask the relative, there's a yes, snoring is there. So in other term, I'm talking about the sleep apnea and how important it is. These are things which are not being noticed by the patient, not being even noticed by the family doctors, not even being noticed by the common neurologists at times. How important it is that sleep-related disorders needs to be diagnosed and addressed in time for the proper brain health.
Thank you very much for such a wonderful question, sir, because these sleep disorders, especially the obstructive sleep apnea, is grossly under-recognized, and it places about a 5 to 10% risk of stroke in these patients who have sleep disorders. And the vice versa is also true. Those patients who develop stroke also develop risk of sleep disorders to the amount of about 1/3 of the patients. That is, 1/3 of the patients with stroke develop sleep disorders. This can either be insomnia, sleep disordered breathing, which is the obstructive sleep apnea. And coming down to this obstructive sleep apnea, which is one of the very common diagnostic condition, which mostly goes under recognized for the fact that it is thought as snoring. Just snoring, and this snoring, when it is associated with collapse of the airways, there is going to be significant amount of oxygen drop in the blood. And this has various downstream effects, and it can result in resistant hypertensions. It can result in poorly controlled sugar levels. It can result in atrial fibrillation, and it can result in so many other downstream effects that ultimately increases the risk of stroke and other. It can also interrupt the sleep, and this is one factor which can also result in the progression of neurodegeneration in these patients. And it is of utmost importance of every physician to include the sleep question, a neurophysician and a general physician, to include a sleep question as a part of his general consultation every time, because a patient does not complain of snoring. So the moment the patient snores, we need to look into the next thing is this excessive daytime somnolence. If it intrudes into their activities of daily living, if they have difficulties in performing their own tasks, and if these patients have sleep attacks, that is exactly as sir was talking about, when they drop down while driving a car, which can be dangerous enough. And it is these patients whom we'll have to evaluate for obstructive sleep apnea with sleep studies. And there are therapies which can help them reverse to their normal life before that they had during this before the sleep apnea. So that's very important thing to be considered. Yes, sir.
Thank you very much. And the message is very loud and clear that only sleeping for 7 or 9 hours is not enough in time. But a sleep has to be a good sleep. That means it should maintain your oxygen saturation. And if you have any of those snoring or up and down and during the breathing, must be evaluated. I think it is very, very important. One person who has been sitting quietly for last 40 minutes and who is the leader here is Abhishek Srivastava, and it would be very unfair not to ask him any questions. So Abhishek, you are the team leader. You run this neuro rehab department. You are the team leader. You got multidisciplinary team. And a patient comes, obviously we only see patients whose brain health has been affected badly. Some patient may be not that bad, but most of the patient who comes to institute like yours or ours are badly affected. Now, when they come, what other thing comes in your mind that how I'm going to get its brain function back to normal, how the brain health I have to look into, and the multidisciplinary team which you got, how you involve all of them, who is what and what is important, when one time. It cannot be that one person is seeing 10 people in a day. There will be fatigue and gone. So you know, this is very important for people to know that these are challenging and how the decisions are being taken. Abhishek.
Thank you. It's a very pertinent question. I think the example of stroke, a focal brain damage. A person with stroke can have multiple types of problems, which you call them as impairments. So if you follow an impairment-based approach, where to identify as a physician who's treating a comprehensive stroke care concept with the stroke patient, look at different components. How is the cognition, how is behavior, how is the vision, the emotional health, the speech, the language, the hearing, swallow, mobility, spasticity, bladder, bowel. So you look into all these 9-10 things and try to identify how these things are affected. And then with the help of a multidisciplinary team, you try to work on all these 9-10 things. One is the compensatory approach. If the deficits are severe, you cannot improve them, to teach them compensatory strategies. If it's a new stroke, they're not very significant deficits, you can try remediation approach, try to improve the function. So both things go hand in hand. First important concept is pick up the impairment person is having. Second, use either a compensatory or a remediation approach, sometimes a mix of both. And third, these patients require intensive therapy especially in the acute stage. They need time. Brain is injured, they need rest in between. So they should not work for 4 hours at a stretch every day. No, they do 1 or 2 therapy sessions, do a session of physical therapy, with speech therapy, rest for 1 or 2 hours, do next set of activities in occupational therapy or sonotherapy, rest 2 or 3 hours, have your meal, come back, take rest, go for cognitive retraining. So intensive therapy has to be given in a specific manner. Like she spoke about nutrition, it has to be timed in a way they get enough rest in between, so their learning ability is always better. And important thing, they should sleep well in the night. If they don't sleep well, next day they don't have to perform. So a payment-based approach, a comprehensive team to deliver activities which is spaced out and tailor-made to patient requirements with pain-free and sleep well concept will help.
The pain-free is what is very important. What you mentioned, the pain is so important. It has to be pain-free. The patient to be active. Thank you very much. So last question, Bhakti, for you is, what is balanced diet for the healthy brain? Many people would want to know, because we also want to know how to keep our brain healthy.
Okay, so when we're talking about balanced diet, it is about all the food groups. So basically, we understand when we are learning, we learn about nutrients. When we try to teach our patients, we teach them in terms of food groups, because they don't understand much about nutrients, but food groups. So overall, we need to keep the inflammation in the body low. So for that inflammation to be low, yes, a balanced diet, maintaining a healthy weight, which plays a very important role. So typically, when we talk about in terms of food group, we go by the concept of the food pyramid that we say, where the base of our diet, we as Indians, the base of our diet is mainly a cereal-based diet, where majority of the cereal parts come in, whether you're eating rice or roti. So we say that a balanced meal should consume at least 5 exchanges of cereals. When we talk about protein, there should be at least 2 to 3 exchanges of protein foods, which can include dals and pulses. And when we're talking about antioxidants, I think our fruits and vegetables, which play a very important role, where we are looking at least 5 to 6 servings. Now, to make a patient understand these servings, what is important is we introduce a concept called the My Food Plate concept, which we say that at least half of your plate should be filled with vegetables and your cereal, and the other half should have your the protein, and there should at least be a portion of dairy-based protein. Fat content, when we are talking about, we give a recommendation for any normal, healthy individual, or even when we are dealing with ailments, we give a fat recommendation, visible fat recommendation of not more than half a liter per person per month. So we have to be practical. When we tell patients use three spoons in a day, it's very difficult for them. So we give a monthly, consumption rate for them, which comes to half a liter per person per month, so that visibly you're not consuming more, and that can be into multiplied by how many family members, and that can be a monthly ration. When we're looking at milk products, dairy products, we are also looking at the fat content in it. So there are a lot of variants in terms of the availability of products that are available, that instead of going for a full fat dairy product, you can go for a low fat or a skimmed variant, which are now very easily available. One thing where majority people go wrong in terms of when we talk about fruits, there are people who create an imbalance in terms of the diet by overconsumption of fruit, which increases excess sugar intake in the diet, which definitely needs to be restricted. So typically, say maybe 2 fruits in a day and vegetables, which should be a part of your meal on a daily basis. So
I think those who need a detailed diet plan from the dietitian, they can contact Bhakti. Here, our idea is to guide the people that balanced diet is important, and we should precisely tell them. Thank you very much, Bhakti, for that. Preeti, last question to you is very short, but because we are now running short of time, and I want to ask everybody. So, what are your advice to the elderly people that when they should worry about brain health from point of view of speech and language and so on? So what are the points comes in your mind that if you have, these are the pointer, you please connect with the neurologist or speech therapist?
Okay. So briefly, I would say always a team matters, because alone we can do so little, together we can do so much. So always we'll have to have a team of experts, look at what are the features that they have. So service coordination becomes easy when we have a group. So when there is communication issues related to cognitive linguistic deficit, we will look at what is the baseline, and then we refer them to neuropsychologist or a neurologist or other neuro rehab professions if there is fall or gait. That is important. Again, when it is swallowing, again we look at what is the level. We see if a behavioral management helps, if medical management is required, or if we have to bring in an ENT specialist or a pulmonologist, we go check how we can work on it. Again, we collaborate with neuro rehabilitation specialists and see how we can go about. So briefly, that I would say is we'll have to have a team which expedites the referral process, and we can collaborate and maintain a goal based on their baseline, to be short, sir.
Thank you very much, Preeti, for precise answer. So Suresh, my last question to you is, what are the opportunity as an occupational therapist you have for the research in brain health? What are the points one can take forward? And this is many young OT might have joined here. What you guide them that they can look into these points and work on this research on the brain health?
Sure, sir. Thank you for the question. And I'm going to target the answer not just for OTs, but for anybody who's involved in helping people who need to kind of make their brain healthy. The basic assumption that anyone who works for people who require to improve on their brain health must understand that neurons are not renewable and brain dysfunction is always irreversible. So this is kind of the assumption that anyone should start off with. And from looking at these perspectives and then looking at somebody coming to you for help or therapeutic support, the opportunities are plenty. The first opportunity that we have is there are many areas of dysfunction, and there are many areas of therapeutic aspects which can help a person with brain damage or to improve an undamaged brain. So comprehensive evaluation and quantification of brain health using one metric is not going to be a solution. So we need a multidimensional aspect for assessing brain health and quantifying it and evaluating it comprehensively. So there's a huge opportunity there. The second aspect is also to look at the mechanisms of brain function. So all of us in the team, we spoke about everything that's interrelated and interconnected. And are we sure that this is the exact mechanism? Can this be disputable? Or can we actually use this mechanism for a therapeutic purpose is something that has got huge opportunities again. Last but not least, the evidence of interventions for promoting brain health. How far we are in terms of justifying that the evidence is of high quality and the evidence is really, really good. So this is a global situation where I'm talking about positive for evidence in terms of improving or using interventions for improving brain health. So there's a huge scope for that as well. Thank you, sir.
Absolutely, thank you. And John, I come back to you again on some important points. And you've been working with a lot of new gadgets like virtual reality and brain-computer interference and other newer technology. How do you think that they are going to change the brain health in future?
I think one of the main things that we see with the newer generation of people itself is that they are more techno-savvy. For my sons are much more techno-savvy, and technology has become part and parcel of everyday life. And we see that a lot of rehab professionals and engineers have come together and developing these devices in India, especially in much lower cost. Earlier, it was all very expensive and not affordable. And I know now quite a few companies have come up with digital technologies that are affordable by Indian community at the health professional level as well as at the patient level. This is going to become more and more prevailing in practice, and it is going to get more and more cheaper and accessible to all. And I feel that this would be one way of engaging patients with the therapist or engaging patients with a lot more activity much for a longer time. Therapist and patient interaction cannot be adequate enough. The time that is they spend together is much shorter to provide a larger benefit. Whereas these technologies will help patients to engage in more activities so that they can spread their activity through the day, through weeks, so that their brain health is much better. And I think this is going to be the future.
So,
Thank you for that.
the question comes here is that yes, younger generation is techno savvy and they are much more addicted to the iPad and computer and phone. Are they missing out on the games and outdoor game which would have developed their brain further? So, is there a role between what we were being trained during our have a lot of time for our friends sitting on the garden, going and playing football or cricket versus the children with all this technology? So you think that in 20 years there would be some new research going to come?
I think so, sir, definitely. And I think there is definitely a big difference in the perception and how we look at the world compared to our next generation. And I'm sure that there is going to be more research on that and to see how the people who were exposed to more technology are their brain health. And we know some of the ill effects as well in terms of the screen time, the also the addiction in social media and other things. So we need to wait and see. And I know already a lot of research that are happening for brain health in children and adolescents involved in a lot of time in digital health. So anything too much is not good. Definitely, we need a balance in our life between real life and digital life.
So, so on this note, the Mangal, what would you advise, a person who is about to get retired or 55 plus, what would you suggest him to keep his brain health normal cognitively? And if there these some points comes that he must consult somebody?
Thank you for the question. I must say that for any elderly person, the person should engage one's brain actively in all of the work. Brain activity should be the same as the brain was doing the work at the age of 25. The work should continue that way. And age is only for the physical limit that they should understand. And if suppose anytime the person is forgetting what is being asked just now, and actually I must say that this uh, deficit starts very early and people don't understand. That is the first sign is people start forgetting the way they were going every day, like for walking and everything, even for the driving, should they turn left or right. If this confusion starts, because this is about the higher cognitive domain. So if this starts, then they have to certainly look into it and start understanding oneself what is happening with them, and they should definitely share that with their caregivers and family so that they can do well after that.
I got one very burning question. John, you and Mangal, if they can answer. 93-year-old lady, Devi, she's won a medal 3 days ago. She ran the full marathon at age of 93. I haven't heard a 93-year-old walking even 1 kilometer and not complaining. What is it is special and extra? Physical strength or the mental strength? Both of you can debate for one minute.
I would I immediately will give up and say it's mental strength. Physical strength most of us have to an extent, but I think it is the determination and mental strength that takes you to break the limit and go beyond. Uh, Definitely, I will say it's more of mental strength. Physical strength is a background. but it can never, to achieve greater things, I think it's the mental strength.
Yes, brain is important. And that means if she is winning this medal and she is running that way, that means her brain is completely healthy. The brain is having all control over the muscles and skeletal things and all other organs. So that's why she can do that.
So I think it may be both. Her brain is very active and which is well controlling her physical fitness. She had no other illness in her body. So
Yes.
she's able to keep herself riding that.
Yes.
Maybe the genetic also, I think. But these are fascinating things that how we look at one only person coming at age of 93 years and running and, so cheerful. So that's amazing when most of the 93-year-old will be sitting in the bed and complaining of thing. Gohan, so last question for you. What would be your advice on this World Brain Day as a neurologist to the society, that how do they look after their brain health? And when they find that these are the important points, don't ignore them, take them serious.
Yes, sir. First, to improve brain health, the concept is the brain health for all is very important, because we need to follow these measures before we develop the disease rather than after we develop the disease. So we need to address all four things that we have been looking together in this current panel discussion. That is, we need to have an adequate exercise, which includes aerobics, strength training, and balance training. And we need to have adequate cognitive training, and we need to have a proper sleep, and we need to avoid substance abuses, and we need to have a good, we need to avoid all the risk factors, have it under control, that prevents us from developing all these diseases. And any neurological deficit, such as if there is a memory impairment, if there is going to be an attention impairment, if there is going to the person is going to develop increased anger outburst at an elderly age, if there are any sudden development of stroke symptoms, these are things that we need to seek our medical care early, because if we can find these and address these earlier, that might prevent further damage as well. And I would like to conclude by thanking Nirmal Surya sir and Abhishek Srivastava sir for giving me this opportunity as well.
Wait. So what you are telling the whole people that become sadhu, they will not like this idea of you telling them that you become sadhu now. Don't, if you want your brain to be healthy. Is that what you are recommending?
Ultimately, it boils down to this point, sir. They'll have to become sadhu at some point to improve the brain health.
Okay, so that's joke apart. Abhishek, there you are. You can conclude, and thank you very much for choosing me to be the moderator today. Difficult task. I had a little bad throat, but still I managed. Thank you very much. Thank you all for attending. There will be another program on brain health at 6:30 p.m. by Indian Academy of Neurology, and many international stars are going to address on that. Professor is Tisha is there, if I'm not wrong. Is Tisha there?
Hi, Nirmal.
Yeah, so at the end of this, the man who is of the moment, the most busiest person today on this globe is Professor Tisha Vijayaratne, the chairperson of the World Brain Day, and he's here to say us a few words on this Brain Day. Professor Tisha, all yours.
Nirmal and colleagues from India, my warmest congratulations for all of you. It looks like you all are at the top of the game this year. The multiple times I have visited your beautiful nation. I come from that part of the world, as you know. First of all, let me congratulate Nirmal's and the rest of the others' leadership to kick off such a fabulous World Brain Day campaign. I would like to remind you all that this is really necessary. It is basically now or never. We know that 1 in 3 of us are having a brain disorder. We know that majority of the brain disorders can be prevented. We know that most of the best philosophical arguments and thoughts were originally created thousands of years ago in the land where you live. We may not recognize that place as India at that time, but that's where brunt of these things originated long time ago. So it is sort of no surprise to see that glory is coming back, and you all are bringing those things back and encourage the rest of the other nations in the world to come with us. I think next 10 years are going to be hugely important, especially with the World Health Organization intersectoral global action plan. Your health minister, my health minister, rest of the other health ministers agreed to work hard to address brain disorders as a main thing to target that across the lifespan, from pre-pregnancy, pregnancy, childhood, growing up, and then growing old with a healthy brain. So as you can see, it is no surprise that we wanted to raise profile of brain health for all with 5 key themes: awareness, prevention, advocacy, education, and access. So you got that. We can only do this by working together. So it is heartwarming to see that the strength and the encouragement that you all are showing to the world. Again, my warmest congratulations, and we watch with intent the way that you all are doing these things, and these are really great things for the rest of the other world to watch and learn also. And thank you so much for having me, even at the last minute, this podium also. And don't forget to join our global webinar, which is about to kick off. I'm getting text messages to get ready.
Thank you, Tushar. Thank you very much, and best wishes for your wonderful work.
Thank you, Nirmal. Take care, stay well and safe.
Over to you, Abhishek.
Yeah. On behalf of Indian Federation of Neuro Rehab, subsection Neuro Rehab in Academy of Neurology, I'd like to thank all the panelists for taking out time and asking very simple questions in a very simpler way. It's a public awareness program. I'd like to thank Professor Surya for taking very, very pertinent and simple questions in simple language, people to understand what they're looking for, especially brain health. I thank Professor Vijayaratne for taking time by busy schedule to grace the occasion. Our tech team, Vivation team, helping us to do this program. And don't remember, from subsection Neuro Rehab IAN, we have 3 webinars on 23rd, 25th, and 27th. Time is same, 4 p.m. to 5:30 p.m. First will be on cognition and brain, which is tomorrow, first is, I think, neuroplasticity, which is tomorrow. 25th is cognition and brain. 27th is neuromodulation. So I hope all of you will join us and grace the occasion. Thank you very much. We had a very, very pertinent, very lucid, and very, we would say, entertaining program to cover all different facets of brain health in a very simple language. Thank you very much.
Thank you.
Thank you, sir. Thank you all.
Thank you all.
Thank you so much, sir.
Thank you.
Yes, sir. Thank you very much, sir.
Bye.